Everyone, let's get this meeting started. This is the March 16th Finger Lakes Regional REMAC meeting. Let's call it to order. Looking for an approval of the minutes from November 19th. Please, a motion.
I can make the motion. So that's Surratt.
Dr. Surratt. Anyone opposed? All right, let's get right into this meeting. I know people do have things to do, and I appreciate you all taking time out. Standing reports, Program Agency Coordinator, please.
Yep. So just giving you a recap of some of the trainings that we've done recently since the last meeting. We did a CLI and CIC instructor updates that we advertised across the state, and had 2 nights worth of education. First night we had 107 instructors sign up from across the state, and the second session we had 129 people signed up for the sessions. So that went over very well, because that education is not offered regularly in any of the regions. Most recently, we had the conference in February that went off pretty good. Had some excellent speakers. That was our first attempt at doing something virtually, and we had very few hiccups, and the presenters presented some excellent material, so we were quite happy with that. Aside from that, it's been just plugging along here on some projects in the office. We're working to get the BLSFRs and anyone else that is still charting with their paper PCRs. We're working to get them switched over to an electronic format that the state has produced for free, that they can utilize, or if they do have, if they don't want to go electronic, the state developed a system called the paper PCR portal, in which they can still chart with their paper, and then they log into the computer, enter some data points, and then they scan and upload that chart and send it off to the state. So that will make it so that none of the paper PCRs will come into the office anymore. So their hopes is to obviously get rid of all the printing costs in the future. So we'll see where that goes. And that's it for right now.
Thank you, John. Moving ahead, FLCC, Donna?
Just to let you know, we have 29 students in the paramedic program that started in January to test in May next year. So they're moving along. They're doing some virtual, some in-house due to all of the COVID regulations and such. So other than that, there are 10 seniors that will be graduating in June. We had to delay it a month because of getting everything in because of COVID. So that's all on course. The difficult airway course will be in May, and we're looking forward to that being offered for this year's students and last year's students that didn't get a chance to have it because of COVID.
I have to say it's nice having some students back in after really a year of not having any. So it's just that little tiny piece of moving back towards some normalcy, which is kind of nice.
And we're trying to move back towards, the college said, has put out that they hope that come September, we will be back in more face-to-face situations and stuff like that. So we were able to, or Jake was able to work with our IT guys on campus so that in the summertime, when they come back for cardiology and everything, that they will be in 2 rooms synced together so that they can stay socially distanced, but all 29 will be back in the building. So, which is good. I think that needs to happen.
Very good. Don, anything further?
Just our spring EMS classes are a little low on enrollment. Obviously, with the state giving the additional year, that deterred some of them from coming back until they absolutely have to. So we'll see probably a little bit of a pickup come summertime and into the fall, I think.
I hope so. I mean, one of the things we've been concerned about is what is this going to do to enrollment across all levels of healthcare? Hopefully, numbers will bounce back.
Yep. Okay.
All right. Thank you. Moving ahead to my report, I don't have a lot to report. We've not had a REMAC or a CMAC meeting recently. There is one coming up. So hopefully by the next meeting, I'll have a little more to report. We do have several cases sent down from the Department of Health regarding agencies and providers that have been found to have had issues against them. Number one is an Andre Volek from Brooklyn, New York. And this is for violations of 10 NYCRR Part 800.16. And that was surrendered New York State certification. The second one is regarding an agency, South Farmingdale Fire Department. As a result of the investigation, they were suspended for 1 year. The suspension is stayed. They were also assessed a civil penalty of $2,000. And the third one is another agency, Citywide Mobile Response. Civil penalty of $25,000. Of that, $12,500 is suspended pending completion of a 2-year period of improvised performance. So, correction, there's one more. Another individual, Firuz Barotov of Staten Island, same thing, Part 800.16, surrendered his certification. Okay. I have no further investigations list to report, so we're going to move on. RSI, RSA. Mike, are you giving that?
I am. Can you hear me?
Absolutely. Please go ahead.
Technology is great. So I'm pleased to report that we were able to complete the lecture portion of the RSI class over 2 Zoom sessions. They were recorded so that people that were unable to attend, unlike in previous years, could attend this time. With that, I'm working on a quiz so that they get maximum out of that. We are moving forward to the practical date, which will be probably in the middle of April. We did send out dates for the end of March, beginning April. There were some conflicts with some people, so John and I made some dates up, and John sent them out. So I'll have that date hopefully very soon.
And Mike,
hopefully, yes.
April 14th and 21st.
I just got to write that down. Hold on a sec, John. So, yep, we have the dates now. Thanks, John. April 14th and April 21st. It will be at MCC, at Mercy Flight Central. It will be the same format as we've done before. There'll be 2 scenarios and a quiz with that. I'll be reaching out to the group to get some help, and we'll go from there. And that's pretty much all we have for RSI. Hopefully by this time in the next REMAC meeting, I'll come back with the names of the new RSI providers, and we'll go from there. And I'll just do quick ALS committee real quick.
Read my mind. Thank you.
Oh, sorry. And then John will be sending out a request to form a tag group within the ALS committee for the refusal forms. I know John will talk more about that in his portion, and we'll be having a meeting probably in the end of April, beginning in May, to work on that. And that's all I have.
Very good. Thank you so much. as part of advanced practice, we do have approval of the SCT protocols. And I know that Brian O'Kay and I think a few others are going to be working on that rollout. So we hope to get that out maybe in the next few weeks. I know we have Brian Weedman on from New York State. Brian, anything you'd like to talk to us about?
Can you hear me?
We can hear you well.
Very good. No, not really. I'm currently in Corning, opening up a vaccination pod. We are pretty much all out doing vaccination-related activities and trying to get our day-to-day stuff done as it is. If anyone has any questions, I'm more than happy to answer. But other than that, I really don't have anything to add.
Does anyone have any specific questions to ask Brian?
Brian, it's Carlotta. I'm going to email you in the next couple hours. I do have a question for you. I won't take it up time here, but you're going to get an email from me.
Okay, I will get back to you.
Brian, will you be able to stick around for most of the meeting and just in case something comes up?
Yep, I'll be here.
Wonderful. We always appreciate having you guys around as a resource. So thank you very much. Okay, moving on to agencies. Mercy Flight Central.
Okay, I think I've unmuted myself. Just a quick thing here, reminder, our education day is coming up on April 14th. It's over Zoom at 6 p.m. So it's virtual education, 3 hours of CME credit. And the response has been great. We've got over 300 registered already. Great thing about these virtual events though is there's not, we're not limited by room size and all that. So if anyone hasn't received the information, but I think most of you probably already have, let me know and we can get it out to you. But it is coming up April 14th at 6 p.m. And other than that, just hoping for more good weather, more spring-like weather so we can do a little more flying.
Tim, that information can also be found on our the Finger Lakes Regional website if anyone's looking for the registration link.
Perfect. Thank you, John, for posting that. It's on, I should mention too, it's on our website, on our, Facebook and social media posts and all that. So thank you.
Tim, you said that's April 14th. Where have I heard that date before?
Yeah. I think, was it Mike that mentioned that for the?
Yeah.
Yeah.
We may need to reschedule. So don't count on the RSI for the 14th until we look at the dates a little bit more closely. I really don't want to, I don't want to cross paths with that. That's too important.
Yeah. Aaron, did you have anything to add about that or anything else?
No, maybe Mike, I can reach out to you and we can talk about dates and make sure those are good and timing wise, make sure it works out, but otherwise I'm all set.
All right, thanks.
Thank you.
Guys. LifeNet and Guthrie.
Good morning. So it's good to see some Zoom education coming out from multiple agencies, and we're also happy to announce that we are presenting monthly cases as well. Last month was our first virtual education event, which was the approach to the airway with over 400 participants. April 7th is our next event, and that will be the general care of the obstetric patient. And you can find registrations for that at lifemetcenight.com or any of our Facebook pages. And I'll also make sure that the REMACs have the appropriate information to post those links in their education calendars. And beyond that, we're also accepting days for your landing zone safety utilization review classes as well. So just reach out to us for those if you need any, and we'll be happy to see you and talk to you at any time. That's it for us. Thank you.
Thank you, Doug. Moving on to our hospitals, Thompson Health.
Morning, everyone. So not too much to report. COVID is still smoldering a little bit. I think we have a handful of inpatients currently. Sort of the biggest event is over the last several weeks, there's been an increasing initiative to be a receiving hospital for transfers, primarily from the southern tier, but places like Noyes and St. James. And the reason I bring that up here is, transfers to our hospital should now go through the Strong Transfer Center. Number one, and number two, there may be an increased request or need for interfacility transport, even sending resources from us to outlying hospital to transport patients here. That's about all.
All right, thank you very much. Clifton Springs, I think Dr. Cullinan had to leave. Is there anyone else from Clifton Springs?
No, I snuck back in.
Great.
So as far as Clifton Springs goes, big notice for this group is that we anticipate breaking ground in the next couple of months on our new emergency department project. One of the areas of construction, the main area of construction that will affect this group is essentially where the ambulances currently park when they come to Clifton Springs. That area is going to be blocked, as it is going to be a new area of construction, essentially out into the parking area, just adjacent to where the current ambulance entrance is. We have a temporary solution in the works that we're working on diagrams and finalizing. And I will get out to this group. And actually, that was one of the questions I had is, what might be the best way for me to ensure that I get the entire group captured when we do distribute that information?
Dr. Cullinan, if you want to give it to me, I can get it out to the masses here.
Right. Very much appreciated, John. So as we get that finalized, we're going to have essentially a temporary solution that will be in place for probably a couple of months that will be minimally disruptive. And we will have a pretty significant change in operations several months from now when they start moving steel and things of that nature and have the cranes up. So we'll keep this group updated and appreciate the help, John. Thank you.
Thank you very much. Moving on to Geneva General and Soldiers and Sailors.
Thanks, Jack. Not much additional here, just reflecting on where we were a year ago. I wanted to make a comment that there are a lot of individuals on this call that have provided great leadership, you know, as we've navigated through COVID, and wanted to acknowledge that, you know, from the medic, you know, to all of the physician leadership and EMS leadership. I think that we've done an amazing job as a region in continuing to care, you know, for our communities, whether, you know, we're in the middle of this pandemic or not. So just an acknowledgement, wanted to thank everyone.
Thank you, Matt. I think I would share your comments. This region really has pulled through quite well. We've continued to try and move ahead as well as maintaining, and everyone should be very proud of what this region's done. So thank you all. Moving ahead, Newark Wayne Community Hospital.
It's Tyler. I have I guess two items, and then Marita's going to talk about the antibody stuff. One is our CT specifically. I think an email already went out about this, but our CT is down today until early afternoon. So diversion primarily of stroke patients. We can still transfer non-emergent patients for CT as needed. And then secondly, a question to the group. For me, I'm getting an increasing pile of the comments from EMS about hospital care and comments from the hospital about EMS care. And I just wanted some feedback from medical directors about when they want to be involved in those. My practice so far has been, if there's something, egregious or, that would meet sort of the threshold for QA review, I'll make sure it gets to you, but I haven't had really anything of that nature yet.
Tyler, I'm sure that every one of the medical directors has different philosophies on that. I as long as I've been in the region, my phone's been on 24/7. I'm available 24/7. Feel free to reach out to me, but I don't want to say that for the other medical directors. I think that's unfair.
Could I just say something real quick? So for as far as I go as well, my phone is on all the time. I mean, if anyone wants to call me, I'll give you guys my phone number. I think for like the day-to-day stuff, just of kind of keeping other medical directors and other ERs, in the loop, I think we should be just kind of dropping emails to each other to let us know kind of what's going on in the field and what's going on with the hospitals. If something, like Jack said, if something egregious occurs, or like Tyler was saying, I think a phone call is always best. It's delivered best. But I personally like to know what's going on with my agencies and my providers, even if not every tidbit is actionable. Sometimes it's best to know everything behind the scenes of what's going on with providers, so you can see trends. I guess that's my major point.
And always feel free to call Dr. Glick about issues that affect my
Same for me with Jack.
Actually, with my agencies, if you want to call Dr. Glick, that's fine as well.
Yeah, I'll be the clearinghouse for any QA QI, any complaints.
All right, you heard it from him.
Up to this point, I think most of what I've had is really, just clarifying communication stuff where, hospital staff may not understand the EMS perspective or vice versa, but I can certainly loop medical directors in on stuff of that level if people are interested, or just if there's quality concerns.
Absolutely.
I think one thing that may be nice is if John could set up just a group for all of us where we can just interchange information, and I'd maybe ask that be done under the umbrella of quality assurance, just to keep those communications confidential, because I think the med directors talk a lot about stuff that we should be allowed some confidentiality, particularly when it involves QA.
Dr. Shred, I can certainly take care of that for you.
Yeah, I mean, it'd be nice to have something like medical directors at remac.com or something like that.
Yep, it'll be certainly the FLREMSC ending to it, but yep, we can take care of that. I'll send out a text group message this afternoon.
And Tyler, I would echo what Jamie said. Marita, you're free to share my contact information. Anything that you feel needs expeditious follow up, just give me a call.
All right. Well, folks, I have to throw in just one comment here. It is just so wonderful to see this many people showing an interest in moving our EMS ahead and being available. Over the past years, that's not always been the case. So thank you. I know everyone's got tight schedules, family, work, all the other pressures, but thank you for taking time out for EMS, because it is so important to this region that we continue to do that. So I just can't thank you guys enough. Dr. Michelin, you had something you want to talk about, I believe.
Just real quick, and I believe some of the other hospitals may be doing this as well, but we did have our first BAM infusion yesterday in our emergency department. We've worked throughout our system to find for COVID those that would qualify for monoclonal antibodies as an outpatient, that we're identifying those and treating them in the emergency department if they qualify and meet parameters for monoclonal antibodies. Bamlanivimab, I believe is how you pronounce it. But we did do our first infusion yesterday, and it so far is going well. So just want to let everyone know, and I do believe that there's other hospitals also looking at doing this as our COVID numbers go down. So.
Is there any
Thank you.
effect that will have for pre-hospital providers and transport decisions?
For BAM specifically, or what exactly, Jason?
For that, is that going to affect what hospital we take people to if one hospital does it and the others aren't?
No.
What's the implication for this group specifically? Okay.
No, it's an outpatient procedure, or not procedure, infusion, and right now we are starting a new work, depending on what Dr. Cullinan decides to do over there or not, number of cases, we're trying to keep them in the city at the Wilson Center, but we are an accessory ED that if people come and are appropriate candidates and don't want to go to Wilson Center, we will do it in our emergency department. So, and these are only outpatients. They're discharged, as Tyler just mentioned, and They have to have no hypoxia within 10 days of their initial illness, and also have comorbidities, since it's still just being used under emergency authorization use. So
Okay.
those are the main parameters of it.
As
So,
I had sent a message out to everyone, and I just want to reinforce, Jason, everyone else, there is no protocol, there's no policy, there's no change in any policy. Patients go, especially if they're critically injured, to the nearest facility, critically ill to the nearest facility. So we're not to make any changes in destination based on that.
Definitely not.
I'll just chime in here. We've been giving the monoclonal antibody infusion for months here in our emergency department, mainly because we've been unable to regionally find a resource to treat these, what by definition are outpatients elsewhere. But I'm happy to give you some feedback on our anecdotal experience here. I mean, there's good and bad that come with offering the infusion, clearly.
Matt, have you seen any side effects from the infusions?
Just ED provider frustration. You know, we're looking at a 4 or 5 hour length of stay for a relatively not very sick patient, but we have not, you have to, you know, the infusion occurs over an hour, then you have to observe them for an hour. We have had 0 episodes of an untoward reaction, whether, you know, allergy, anaphylaxis, or otherwise.
Matt, the last time we looked into this, it was actually a husband and a wife, and the wife had received the infusion at Thompson's ER. And so the husband was demanding it, I think, at Soldiers. And so we did a literature review. This was maybe a month ago, 6 weeks ago. And is there, so at the time we did the literature review, I didn't feel that there was, you know, I guess, definitive evidence, as is often the case with the treatments we're using. But do you know if there's any newer literature on it?
I do not know. Yeah, I mean, the number needed to treat was like 20 or something to that effect. And the outcome, what was studied was essentially these patients' need for future medical contact and primarily hospitalization. I mean, the whole reason it got its emergency use authorization was to prevent these people from clogging up our inpatient wards and ICUs in essence. So I'm not sure. We actually just this week are now switching over to a dual antibody. I forget the name of the infusion, but it's not just bamlanivimab, it's bamlanivimab plus something else. So
okay.
The literature and support is sketchy.
Agreed. It's not clear whether it's the side effects are pretty mild, and we really haven't had, you know, any in our system either. And we don't know how much benefit it brings, but it was just trying to, I think we're all doing this to try to offer something for those that are very high risk. So.
Got it. Thank you.
Thank you, everyone. Is there anyone else that would like to speak? We're out of listed agencies and groups, but if anyone else has anything to bring forward.
Yeah, Jack, I just got something quickly.
Yeah.
Just wanted to recognize Wayne County ALS have been going out into the field and giving COVID immunizations. I'm not sure if there's any other agencies in the region that's doing it. Driving force behind it really was Jason Hagg, so he deserves special mention. But pretty much every day, 2 of our 6 or 7 cars that are up are going out and immunizing about 10 people each, so 20 a day. I know it's not a great number, but it is something. And I think we're one of the first agencies to actually be going out, partnering with public health to do immunizations in the home. It's a bit of a pain in the ass because our paramedics have to sit there for half an hour with the patient between the initial evaluation and then the post-immunization observation period. But I give kind of a acknowledgement to Jim Lee for supporting it, Jason Hagg for pushing it, and for public health at Wayne County for providing us with the immunization material and also the patients to do it on.
Jamie, that's absolutely
That's
wonderful.
fantastic.
I mean, this is the move towards community paramedicine that we've spoken about for years. We've just been delayed in New York State, unfortunately, but you're making the first move. I'm assuming the people that you're vaccinating are people that would have had a hard time getting vaccinated otherwise, high-risk folks. Just tremendous. So thank you, medics, for doing it. Jason, Jim, thank you.
Yeah, and I would say that if any other agencies are interested in our experiences, then just reach out and contact us. We'll be happy to support you in developing a program in your own region.
Wonderful.
Amy, you guys should reach out to the papers. I mean, any good publicity for EMS pre-hospital care is good for everybody. Get them to recognize it.
Absolutely.
It sounds like a great thing for our operations staff to do.
Yeah, we'd think about doing that, but just by putting it on Facebook, there's been a response that's a little bit more than what we can handle. We're actually funneling through the Office for the Aging, as where we get the names of the homebound who are interested in getting vaccines at home. So it's a little overwhelming at this moment.
Well, please keep it up. That is tremendous program. Thank you all.
Right. And Jim, we were gonna kind of join forces. I'm waiting to hear from Diane Devlin. I still hadn't heard back yet, but it sounds to me like we need to be careful about expanding this until you guys have some bandwidth, or because we were gonna try to help, as far as PR and get the message out to Wayne County at least. So we should wait a little bit. Is that what you're saying?
Yeah, probably. I mean, we're only doing it when they have the Johnson & Johnson or the Janssen vaccine. So that's the one dose, which we don't have any this week. They're going to have some more next week because, we're having a hard time keeping up now with the single dose. If we had to do it with the 2 dose, like with the Moderna, it would be just beyond what we could do, to be very honest with you.
Okay.
Very good. Listed under old business, we have the nitroglycerin protocol. This was tabled previously, partly because of storage and size of containers. And I don't believe that there's been any change at the state level. Brian, are you still online? Has there been any movement you've heard of at the state level that would allow us to have IV nitroglycerin on board?
Yes, I'm here, and no, I don't believe so. Not that's been passed down to us, not since the last, nothing new from the last SEMSCO meeting.
All right, it may come back up again at the next SEMSCO meeting, so I will try to bring it forth at CMAC and see if we can get it across in some way. Thank you.
It sounds like that whole emergency reg package is still sitting wherever it's sitting.
That's not really a shock. All right, under new business, I think we've pretty much gone through this. The rollout for training is in the process of being developed for SCT. I think that's going to be a real boom to the area for our transports. And as we've heard, we may be seeing more and more interfacilities, so that may be very helpful. Refusal forms being worked on. Does anyone else have any other new business they'd like to bring forth? Going once, going twice. Motion to adjourn.
Just some guys doing a talk at pediatric sepsis at Vital Signs Academy tonight. If anybody's interested. Shameless plug for myself, but nonetheless. Ped sepsis at Vital Signs Academy at 6 o'clock.
All right, so anyone that's got time tonight to get on board and heckle Dr. or Mr. Haig, please feel free to do so. All right, one more time. Anything new? Motion to adjourn, anyone?
You got it from me.
All right, I don't think there's not going to be any objections. Everyone, thank you so much. Everyone stay well, be safe.
Take care, everybody.